essentially we're coming up trying to develop combinations of these new targeted treatments to try to eliminate either in the short term but particularly in the long term leukemia, in this case chronic lymphocytic leukemia. So the overarching purpose of the research aligns with what I've just said. Chronic lymphocytic leukemia is the most common leukemia in Europe and North America. And while many patients have a good prognosis, people who relapse early after our current standard treatments or who don't respond to current standard treatments have a very poor prognosis akin to some of the acute leukemias. So new treatments are very much needed, and there's been significant advances in the last couple of years in this space. One of those advances is this drug venetoclax, which is a tablet that's taken each day. It's designed specifically to target a key weakness in some blood cancers, in this instance chronic lymphocytic leukemia, and it works, and I'll show you on the next slide how that happens, by telling leukemia cells to drop dead. And they do this by a process that was discovered in research over 50 years ago by apoptosis. And so the idea of this study is to combine this new targeted treatment with another non-chemotherapy drug that's been around for a long time. We know a lot about it, and that's rituximab. So this slide just outlines the mechanism of action of venetoclax. Now, CLL cells depend for survival on a protein that's within cells called BCL2. It was first discovered about 28 years ago, and its function was discovered 26 years ago, and this drug was first generated just on 5 years ago. And what the drug does is it turns a CLL cell that's happy under any stress because it's got a lot of this BCL2 protein. The drug comes into the cell, it binds to the BCL2, it switches it off, and the CLL cell can no longer survive, and it undergoes a process of death, and that takes several hours. So the action of this drug is very quick. Turning to the results of the research, this trial included 49 patients, all of whom had CLL that was not doing well with current standard treatment and had returned or was refractory to treatment. Of the, all of the patients received 6 standard doses of rituximab, and then subgroups of the patients had different doses of venetoclax. All those doses worked, so they're pooled for this analysis. Overall, 41 of the 49 patients had a very good response by our standard criteria. 20 patients achieved what we call a complete response, which is when you see no evidence of chronic lymphocytic leukemia by just standard technology. Of those 20, 13, we couldn't find any CLL using very sensitive research techniques. And excitingly, 6 of the patients, in fact, elected to stop having their venetoclax treatment, which in others was ongoing. And to date, only 1 of those 6 patients of mine, and it was only 2 weeks ago, hence different information in the written abstract, only 1 of these patients has had recurrence of disease, and that was 2 years after they stopped treatment. So this is a new targeted therapy that in combination may mean that we can have a treatment course that isn't ongoing in the long term. So in conclusion, venetoclax and rituximab is a very active non-chemotherapy treatment for patients with relapsed refractory CLL. We've learned how to give this combination safely, and to establish formally just how much of an advance this may be, there's now a randomised study ongoing between what would be the standard treatment, which is chemotherapy plus rituximab, and the chemotherapy is bendamustine, versus the venetoclax plus rituximab.